Welcome back in. You have cancer. Those are 3 words that can change your life. You'll have questions, concerns, worries, and more. At the Toledo Clinic Cancer Centers, there are people who help hold the patient's hand through their cancer journey. Ashley Slawinski is here with us this afternoon so we can learn a little bit more about the Care Navigator program. Good afternoon. Thanks for being here today.
Thanks for having me, Amanda.
Absolutely. Okay, so what is this Care Navigator program?
Well, let's back up a little bit. First of all, the healthcare system, we already know, is incredibly complicated when you don't have a cancer diagnosis. When you do, much more complicated to navigate. So we instilled a Care Navigator program at Toledo Clinic Cancer Centers back in May of last year. And our Care Navigators essentially take the patient by the hand, as you said, and walk them through this journey. Our patients get a direct line to their particular navigator. They can call for any question related to their treatment. If they have a question about a scheduling snafu or where to go to get testing, they can ask clinical questions, community resource questions. We even have financial navigators that can help them navigate that part of the process.
Yeah, so on top of it, they're dealing with their health, trying to get well, trying to do what they need to do to be better. And then you're like, okay, now the bills are starting to roll in. And you've got all these questions. So there's just this one person who a patient can contact and get it all answered.
Yes, everything that they need, they can go to their navigator and he or she will be able to get them to the right person. If they don't know the answer to the question, they'll get them to the right resource. Like I said, they'd really just grab the patient by the hand and say, I've got this for you, don't stress.
Oh. Yes, that's one thing that you can take off their plate because, yeah, I think you're, okay, I've got this doctor I got to see on this day, and then I got this doctor and I got to get in for this treatment, and just keeping it all organized is really, really stressful. So is this for anybody who has a cancer diagnosis or, you know, just Toledo Clinic patients, or how does that work?
Just Toledo Clinic patients. We do actually have a partnership with several other community health centers and hospitals in some of our rural areas. It's called our Cancer Care Alliance. So our goal is to get it out to some of those other rural areas here in this year, 2024. But so far, yes, it's just the Toledo Clinic patients with a cancer diagnosis.
So can family members help out their loved ones in working with a Care Navigator?
Absolutely, absolutely. Even if they're not on a HIPAA form, our Care Navigators can help them navigate that portion so they can get added to the paperwork they need to be able to help handle those situations.
So you have, first of all, I learned today that Toledo Clinic has cancer centers. So you have a few of them. Where all are you located?
We are located in Monroe, Michigan, in Maumee, in Toledo on Holland, Sylvania, and in BG at the Wood County Hospital.
So you really have the whole area for the most part covered. So if you're a patient, most likely you'll be able to get connected with whatever you need during your treatment process to feel better.
Absolutely.
Do you know, when patients come in, maybe what's the first step that they should take? They hear those words, you have cancer. What is the first thing they should do?
They actually don't have to do anything. Our Care Navigator, we try to meet every single patient at their first appointment, explain everything to them, give them their direct line so that they just have to call. They don't have to go through the phone queue or anything else. They get directly to their navigator and they just answer all their questions. They don't have to do anything. We just offer it, we explain it, and they consent, and we provide everything we can to help them get through this.
You said the word queue. How many times do you call a doctor's office and then you're like, you're number 5 in the queue or whatever, to try to get connected to somebody to get some answers, and before you know it, you've spent the entire morning or entire afternoon on the phone. So they will have a direct line.
Yep, direct line.
To call their navigator to help them with anything.
Absolutely. Yep.
Wow. Okay. So, and as you mentioned, they don't really have to do anything. You get that diagnosis, and someone will be connected. With you.
They don't have to do a thing. We take care of all of it for them.
And so, say you have a family member right now. We might have some people watching. They're like, oh, my loved one just got this diagnosis. Can somebody go somewhere to get more information? You have a website, right? Yep.
We have a website, and I know that we're going to put the number up here. You can give us a call. Wonderful. Give us a call and we can explain the program to you. Again, if you're a Toledo Clinic patient with a cancer diagnosis, we want to be there for you and make this as easy as possible for you.
And it's just huge because you've got so much on your mind, and I can't even imagine, you get that diagnosis and you've got a ton on your mind. So this is a little something to help maybe ease that and make sure you are doing the right things, because sometimes you get lost and you're like, oh, I missed this this appointment, or I missed this, or I missed that. So you have somebody to kind of keep you
Absolutely.
on track.
And we do a lot with what we call barriers to care and social determinants of health. So if you have a difficult time getting to your appointments, you have transportation issues, or you just can't afford the gas, we can help you with everything you can imagine. We have a resource or a connection for you.
Wonderful. So get connected. Ashley, thank you so much.
You're welcome. Thank you.
We appreciate it. Stay with us. We'll be right back after.